right, perfect. Well, thank you so much for taking time out of your day and sitting down with us. So, the first question we want to know about you. What's your history in the medical field?
Sure. So I started out as an intern at the National Cancer Institute in basic clinical laboratories and had a chance to, one, really enjoy the role of science as it relates to improving human health. That was at the National Institutes of Health in Bethesda, Maryland. And I had a 21-year career there in total, but advancing through as an intern all the way to be an executive officer and oversee the operations of a large research institute. That was the National Eye Institute, where I was the executive officer for 8 years before I transitioned to the VA 5 years ago.
And what made you want to transition over to the VA? What stood out about the VA in your opinion?
Well, a couple things. One, my career had closely followed what you might have in a basic research discovery and advancement into a clinical trial and then ultimately into a way to improve human health by starting out in a basic lab and then coming to the VA. But the real reason for me to come to the VA was I felt it was the best public integrated system of health, and I wanted to make sure that I continued my public service in public health, but also to serve veterans. And I really felt it was important for me to apply what I'd learned in the 21 years of my career at NIH to come help the VA. As I mentioned, I came 5 years ago, right at the time the VA was facing a major crisis with access with the Phoenix scandal that was there, and I thought it was the opportune time for a leader in another agency to then come to the VA and perhaps bring different ideas to improve our healthcare delivery system.
That's what I was kind of thinking. You felt like you could probably bring a different approach to the table than what was already going on.
Correct. And so, one, it's a sense of public service, but it's also a commitment to public health and then delivering that care to those who I think are the most deserving, and that's our veterans.
And most recently, before you got here to Lawrence County, you were at the VA hospital that was in Oregon, correct?
Correct.
All right, perfect. So can you tell us about your time there, please?
I will. So I previously served as the chief operating officer in Florida, and my boss was out in that hospital as part of an investigation. There were some serious allegations, and it was a hospital that had a lot of challenges. And my boss had said, this is a perfect opportunity for you to go and lead an organization that really needs some extra help. And it was a chance for me to determine whether or not I wanted to end my public health career as a medical center director. So I was there for nearly a year. It was a facility that had a 1-star rating. It was rated as one of the 15 worst VAs in the country. There were significant management and leadership issues, and so my job was to go there and really clean up the hospital. So started that process by talking and interviewing staff and the community, and then also had the benefit of a number of reports and reviews that had been done. And so my job was to fix that. And I'm proud to say that over the course of a year, again, involving our employees and engaging our employees as well as veterans, we moved that facility off of that high-risk list. It's now a 2-star facility, well on its way to being a 3-star facility. And then I had to recruit all the new leaders that ultimately were replaced, a chief of staff, a chief of surgery, a number of other key critical positions that I had to recruit and bring in new leadership who were aligned to a view that we wanted to make the employee experience the absolute best, and knowing that that would also lead to the best outcomes for our veterans.
And you talked about it a little bit of like as far as recruiting, but what else did you have to do in order to move that VA in the right direction?
We really needed to listen to the community and to our veterans and learn from their perspective about what worked well and what didn't. We had the same kinds of crucial conversations with our employees, and then literally had a strong communication plan about the changes that we would make and make sure that there was buy-in from our staff as well as our veterans and the community at large. And then we worked that plan and made the changes that were necessary to move the hospital to its 2-star rating and then ultimately to the 3-star and beyond.
Perfect. And, compared to the Oregon VA, is there any similarities you see at our VA here in Dublin?
So in a lot of ways, the VAs are very similar. This was a small rural level 3 facility in a rural part of Oregon, literally a town of about 18,000 people and 1,200 employees, so not too dissimilar to Dublin, where we have about 1,500 employees here in a town of about 17,000 people. So the role the VA director plays in a community is not just about the VA, but it's really collaborating with the state and local leaders as well as the business community and the veterans, and you're an important part of that community. And so I really enjoyed that role while I was in Douglas County, Oregon, in Roseburg, and I've been able to take those experiences and bring them here to Dublin.
Mm-hmm. And, why did you decide to come to Dublin? I'm sure there were other places that you can choose to go to, but why here?
There were. I had a chance to interview at about 6 different VAs. I really liked the feeling that I had in Dublin and the fact that I felt I could make a great positive difference. One, I want to bring what's called a whole health program to Dublin, and this is a chance where we're assessing the needs of the whole veteran and really understanding how we can help them, not just with individual programs, but recognize that we needed to be able to think of the holistic needs that that veteran had. And the program really has not been established here, but I think there was a great opportunity for me to bring that program here, especially considering the large mental health population we have with the domiciliary, as well as with our primary care team. So I was very excited about being able to do that. For me, I wanted to be on the East Coast and relatively close to my home state of Florida. So this Dublin is really the perfect place for me and for my family to be.
Mm-hmm. And for you, what do you feel makes your leadership style unique here to Dublin? Because there have been some directors here who've held your post. They haven't stayed here too long, rather they've been interim. But what makes your style unique for you to think that you're able to come here and lead the VA in the right direction?
So one, I think probably an atraditional leader for the VA, in that I didn't grow up in the VA. I grew up at NIH, where I felt it was more of a meritocracy. And really the best ideas that one had across the table were the ones that won the day out. And so I think being an open and transparent leader and recognizing a peer review process where the greatest ideas may be right at that frontline employee, but you have to be willing to listen to those and provide an environment of safety where that employee feels like, I can raise this issue about something that's not working right and know that I'll be heard. And if that issue is resolved and or we move forward in that direction, great. But if not, there's communication about why that wasn't the avenue that's taken. So I think I'm different in that regard, in that I didn't grow up in the VA in a more hierarchical approach. My approach is more broad-based and transparent. So.
Perfectly. And since you've been here at the VA, I know you said when you were in Oregon you had to make some leadership changes. Was there anything that you saw kind of off the rip here that you wanted to change, or any people that you wanted to switch out, or is that still in the process?
I'm still in that process of evaluating. I'm well within the first 90 days for me to really make sure I listen to all perspectives, listen to our veterans, listen to the staff before I make those kinds of major changes. We are recruiting a new chief of staff, and I hope that we'll be able to announce the selection very soon. My goal was to make sure we had a permanent leadership team in place, so I'm excited about bringing on board a new chief of staff.
Mm-hmm. Once you came here, were there any vacancies in any of your department?
So the chief of staff is the critical vacancy. We've had a number of interim chiefs of staff, really over a 2-year period of time. We haven't had a permanent clinical leader, and I felt like for us to move our programs forward, we needed to identify and bring on board a great clinical leader.
Mm-hmm. And the chief of staff, kind of, what does their position look like, if you can explain it briefly to us,
Sure.
please?
The chief of staff oversees all of the medical lines of service, so mental health, cardiology, medicine, emergency medicine, primary care. All clinical avenues is ultimately the domain of the chief of staff. The chief of staff is one of the key positions that reports to the director as well, along with the associate director and the nurse executive. And the 4 of us make up the leadership team for the organization.
All right, perfect. And continuing to move forward, we've heard a lot about the Mission Act. We've got a lot of emails about it. So if you could explain to us, because it's a little confusing, a little convoluted, what is the Mission Act? How is it going to help our veterans?
Okay. The Mission Act is actually an acronym that stands for Maintaining Internal Systems and Strengthening the Internal Outside Network. And so the first part of that acronym, maintaining our internal systems, this is really an opportunity for us to build on the infrastructure that we already have here on the campus. And when I talk about infrastructure, it's not just buildings, but it's also giving us new tools to be able to recruit and retain our clinicians, to be able to pay them a bit more, as well as to provide some retention authority, but also for some of the new investigators and the new providers that we have, a way for us to help them with their student loan debt, and as long as they have a service agreement that they stay with the VA for a period of time. So it gives us some new avenues to recruit and retain providers. In addition, there was some additional money for us to build new buildings on the campus. So our mental health building is one example of that. So the first part of maintaining our internal systems so we can deliver outstanding care through VA providers is one aspect of it. But the other aspect is to strengthen the internal outside networks that we had. So it took, the VA had three different programs that provided care in the community to our veterans. And depending on how a veteran may qualify for that care, it depended on which program that they would go through. I think that it was confusing for our veterans, as well as confusing for staff sometimes, of which of those programs they may have qualified for. So the Mission Act actually consolidates that the integrated outside network of providers into what's called a community care network, where if a veteran is unable to get care within the VA for 20 days for primary care or 28 days for specialty care, then they're automatically eligible to get care in the community, and then we would pay that bill for the provider. And so there are a number of other aspects of how a veteran would qualify for that care, and tools that we can help them determine whether they qualify for that care. But the real goal here, or I should say the real component, is about competition. And that if we're unable to provide that service in a timely and quality way, it will empower the veteran to have the ability to go and get that care in the community. And it's that competition that I think will drive greater innovation inside the VA to deliver that care, and also deliver a better value to that veteran as well as to taxpayers.
Mm-hmm. First thing, from what you said retention. That was a word that really stood out to me. So is the VA seeing it as to be a little bit more competitive with the doctors and staff members that you have with outside agencies in order to keep some of those people?
Correct. So many of our providers have complained about, they would love to serve veterans, but navigating the system to come in and go through the different HR hiring practices can be very challenging, as well as understanding the pay. So we have new direct hire authorities for our providers. I mentioned as well, there's an opportunity for us, for doctors that we've trained, to be able to stay within the VA and then also help pay off their student loans. Is a big deal for many of our young providers, again, provided that they sign a service agreement that they'll stay and work with the VA for a period of time. So it just gives us a lot more flexibility to be able to pay those doctors, to be able to provide incentives, payment incentives, to actually retain them. And then there's what's called a retention authority that again provides us with an ability to, a financial incentive for them to stay in service for the VA.
And secondly, when you were talking about the veterans, you're talking about appointments in a timely manner. Is there something that the VA has set up for a definition of timely? Is it, an appointment within a week or 30 days? Or
So for primary care or for mental health, which I consider to be our foundational services for our veterans, it's within 20 days. But there's also a driving time distance as well, and that's by 30 minutes. And we actually have a tool that our clinicians use that will help determine the driving time for that veteran. And if they live outside of that time, they're eligible to be considered for community care, and we would give that veteran a choice. Now, again, our goal would be that they choose to come and get their care at the VA. And so we try to make sure that we can meet the timely standard, as well as make sure that the care is so outstanding that a veteran might be willing to drive 30 or 40, 50 minutes, whatever it might be. For specialty care, these are things like cardiology services or more advanced things. It's actually 28 days in which we would have that appointment, or up to a 60-minute drive time. But the clinician, the primary care doctor, has the ability to determine the best medical interest of the veteran and explain to the veteran what would be community care options for them, or to be able to get their care in our VA, or for very complex care that we just don't offer here, to be able to get their appointments in Atlanta or Augusta, which are more complex VA hospitals in Georgia.
Mm-hmm. So do you feel like the Mission Act is going to help?
I do. It's going to give me as a director much more flexibility in again, improving our internal systems, but also more flexibility in how we coordinate that care for the outside. And there will be many instances in which our veterans will need to go and get care in the community. My interest has always been, one, to make sure that we get the bill from the community provider in a timely way, and so the Mission Act does set up electronic systems for us to be able to receive the bill from the outside provider, for us to be able to pay it much quicker, and then that way the veteran doesn't see a debt collection notice or anything like that, that we can pay it quicker. But to me, more importantly, that episode of care that occurs in the community, we can get the electronic health record component of that back into our own systems, so that when the primary care doctor sits down with the veteran and says, I understand that you may have had this particular procedure out in the community, and now I have a chance to actually see what actually was done by that community provider, and then they can have that conversation with the veteran. So it really strengthens the relationship with the community in terms of our bill payment, but also the information from that care episode back into our electronic health record for the veteran.
Okay, and I heard you say better flexibility. Before the Mission Act, what was the flexibility for VA directors, or how does the Mission Act improve that for the directors?
I think it was probably more bureaucratic in terms of making that case for care to be done in the community versus being done within the VA. So for example, right now we conduct most of our sleep studies. If a veteran has a sleep obstruction and it's impacting their ability to get a good night's rest, before, all of that work was done in the community. And I think for many of our veterans it was somewhat disjointed that they would have to have a consult to go out into the community to get that sleep study, and then come back to the VA for us to read the sleep study and then determine if they needed a CPAP or some other machine to help them with their sleep. We're going to actually, because of the Mission Act, we'll have flexibility to actually create that program in-house. So now a veteran who has a sleep disorder can get a single consult, and we're putting this program in place now. So it's not currently available. We've hired a new pulmonologist and some other new people to be able to put this program in place, where we'll be able to do the sleep studies here, and a veteran can come and stay overnight, and we'll monitor the sleep activity and be able to then determine what they may need to assist in their sleep in the future. And so it's not that we didn't have that flexibility, it's just that I think I have a greater range of flexibility to determine what's in the best interest of our veterans and how we can best deliver that care.
Mm-hmm. And with the Mission Act, let's say, speaking hypothetically, if somebody can't get their appointment until after 20 days, how does it work? Does the VA say you can go to any doctor you want? Do you tell them which doctor that they can go to in their area? How does that work?
So we have a third-party administrator, TriWest, who's assisted us setting up an outside network. And so when we're unable to meet that timely standard for a veteran, we have a tool that will then identify where they can get that service. And then the primary care team can advise the veteran that we're unable to meet our own timely standard. So you have options. We can help you get this care out in the community, or if you wait, to 27 days, whatever the next available appointment is, you can still have your care in the VA. So that gives the veteran the information for them to make the choice about whether they want to get that care in the community or to actually come to the VA. And so again, if we're unable to meet that standard, we'll be able to talk to the veteran about what we can do and what the community can do, and then the veteran can decide where they want to get that care.
Mm-hmm. And here in Central Georgia, we have a lot of rural areas and a lot of veterans who live out in that area. So for a veteran who lives out in this rural area and they don't have a VA close to them, or they don't have a doctor close to them, how will it work for them, in their favor? How will they still be able to get that proper medical attention?
Well, there's some things that I believe the Mission Act will truly help our veterans in rural areas, and one is telehealth. And so while we may not have that particular service here, we're offering those services at our community-based outpatient clinics that we have in Milledgeville, we have in Perry, in Macon, in Albany, in Brunswick. And so there will be a telehealth component that the veteran can go to those community-based outpatient clinics, which are closer to their homes, and still get that care through a telehealth program. But we can also still assist them through transportation to get to the other sites of care, whether it's here in Dublin or our sister facilities in Atlanta or Augusta, to get that care.
Yeah, but that's a perfect segue to my next question. As far as transportation, is there a service that the Dublin VA has that a veteran can call up and be like, hey, I need to get to my appointment, because they don't offer a transportation service here where I live?
We do. We have a Veterans Transportation Service, and we're also fortunate to partner with the Disabled American Veterans, the DAV, which they have a great program. They have vans that are here. So we do have programs that can help our veterans get to their appointments.
Perfect. And moving on to customer service, that's something that we've heard from a lot of veterans. I've been to a few of the town's halls. What is the process of workers here getting trained on customer service?
We do have training for customer service as part of new employee orientation, and because now the focus really is on the customer satisfaction. And again, when a consumer has a choice over where they get their health care, if the experience that veteran has is outstanding, then they're likely to choose the VA to get that care. So we're training our frontline clerks in terms of that customer service, but also our providers as well in how we communicate with our veterans to make sure the total experience that they have, from calling to make the appointment to coming in and waiting in the waiting room and being received with a greeting and thanking them for their service, as well as the appointment they get for the veteran, that experience is so outstanding that they choose to come to the VA, even if we're not able to meet our timely standard. And we're working right now to make sure we bring in new providers to meet that access standard. But when we're not able to, the veteran will say, it may take me a few extra days, but I really like the care that I'm getting at the VA, and I want to choose to come to the VA.
Mm-hmm. And when you say timely standard, what's that?
So again, for primary care and for mental health, it's 20 days. And for any of the specialty care services, as I mentioned, cardiology or pulmonology or urology, any of those, it's 28 days.
All right, perfect. And the next question, as far as the customer service training, is it online, is it in person, and how frequently, even if an employee already does work here, do they have to go through it, or is it just a one-deal type of thing?
Well, we have regular training that is online through our TMS system, but we also offer training courses. We'll be bringing people in to do that kind of customer service training. And it's different kind of customer service training, particularly for those that answer the phone in our call center, and to make sure that veterans have again a good experience when they call our call center. But also when a veteran comes into the appointment and the clerk is there to check them in, that experience of making sure that we're making eye contact, we're smiling, we're acknowledging the veteran. So we do offer that training to our staff as part of a new employee orientation, but we'll have ongoing training as well to make sure that we have good training.
And if a veteran or a veteran family member, they have a complaint, how can they go about issuing that complaint? Who do they talk to, and what's the process? Do you all just get the complaint and just add it to the list, or is somebody actually talking back to them?
We do. At the medical center, we have a patient advocate, and veterans can go to the patient advocate and lodge a complaint. There's a process for us to actually resolve that complaint. Also, a veteran can contact the White House hotline, and that actually is a system where we get the specific complaint and we work through problem resolution and literally follow up to make sure that the problem that's been identified, one, for that veteran has been solved. But more importantly, we look at it if it's a systemic problem, and then we try to fix the system problem that created the one issue that a veteran raised, but it actually prevents then other veterans having that same problem. So it's a part of a learning opportunity for us that when there is that problem, we learn from it and we get better as a result of it, not just for that one interaction, but really for all the other interactions that follow.
And then the next question, if you could explain the process, because this is another topic I've heard a lot of vets talk about, appointments. What's the process of a vet getting set up for an appointment with their primary care physician?
Sure. So veterans can make an appointment by calling our call center, and that's 1-800-595-5229, and they would just select option 3. But they could also come in and then work at the specific clinic and ask to make an appointment. We also have online scheduling that's available for all of our locations in primary care and for mental health. And so then for veterans that are enrolled in our system, we train them to use what's called My Healthy Vet. So it is an online tool for veterans to not only make appointments, but also to have secure communication between themselves and the primary care teams that they're being seen with.
And we've had a few cases, and I've heard at the town hall myself where some vets are like, I get to my appointment and the appointment's been canceled, unfortunately. So what are you all doing to notify those vets in advance? Hey, something's come up. We had to reschedule your appointment.
So that happens when, for example, a provider has called out sick or there's been some other kind of an emergency. And so that's a very unfortunate event to be able to travel here and not have the appointment. Fortunately, that doesn't happen very often. But when it does, our veterans enroll sometimes, they can enroll in what's called the Vet Text program. So literally, we can text them to let them know there's been a change in the appointment. But our primary care teams also make phone calls to those veterans to let them know that the appointment's been changed for some reason.
Perfect. And you already talked about it a little bit briefly, the phone call and then also the text message. But, some vets, the older ones, they're not really tech savvy. Is there a process or something in place to try to let them know that their appointment's been, rescheduled or anything like that?
A lot of times it's a phone call, really, and it's the personal touch that one of our clerks who works in a primary care team. So our primary care teams typically have a panel between 1,000 patients, and the primary care team is that frontline scheduler, a registered nurse, an LPN, and then the provider, one of our primary care doctors. Those 4 individuals make up a team, and then in the course of the day, they're looking at all the patients that they're going to be seeing that day, and it gives them and the panel, the team, a chance to know all of the veterans that are part of their 1,000-person group. So.
And this is just an extra question. With that, if a veteran's appointment was ever canceled or had to be rescheduled, would that veteran maybe have, through the Admission Act, the chance to go to another doctor who may be closer by if they have something that's a little bit more urgent?
If certainly they would, and that's an option that could be presented to that veteran to say, I'm sorry that the visit was canceled. Here is another option for you. Either we can get you the next available appointment, which might be a couple days later, or we can help you identify a community care provider that can give you that service. And sometimes, though, the community really doesn't have any better access standards than we do. So we'll offer that option, but a veteran may realize that they could just wait a few days instead of waiting another week or so to get that appointment in the community. But the key part of the Mission Act is it does empower our veterans to make those choices.
And just to be crystal clear for those folks who live out, let's say, for example, Dodge County, and they have an appointment at the Perry branch, then they're able to call a number if they need to set up a ride to come pick them up and take them back and forth from their appointments if they need to.
Again, through the Veterans Transportation Service and DAV, we have those transportation options that are available.
And this is going to be our last topic, mental health. It's something that we hear about a lot these days. So here at the Dublin VA, what are you all doing to address mental health issues with our veterans?
So one, mental health is a foundational service that we offer in the VA. And while there are plenty of outstanding mental health professionals in the community, they don't always understand the mental health needs of our veterans and those challenges. Whether it's post-traumatic stress disorder or military sexual trauma or just when one is in combat or in service, there are different invisible wounds that are there that private sector providers may not truly understand how to treat. So first of all, we make sure that we have plenty of mental health providers that are here, and we also recognize that someone in mental health crisis can't wait 20 days for that service. So we do offer same-day access for that kind of mental health service, but we're also going to be enhancing that through things like Video Connect. And again, this is a tool that we can provide to veterans so that when they're in crisis, they literally can use their phone or tablet or other device to connect with a mental health professional to get the help they need now when they're in crisis. So for me, again, recognizing that mental health is just such a foundational service for us, our first goal is to make sure we've got the appropriate internal infrastructure to meet the needs of our veterans. So we're expanding that here on the campus in Dublin by, we'll be opening up our outpatient mental clinic. It's about 25,000 square feet that will allow us to serve more veterans and serve them much quicker by having that one unique building and space available for our outpatient clinics. And then, of course, we have a number of inpatient opportunities as well for mental health through our residential treatment programs for PTSD and substance abuse, as well as other mental health disorders.
So are there, like, for example, are there beds here in the Dublin VA, if somebody is going through a mental health crisis, that they're able to go here, just so they can go through that process?
We do have 164 beds that are dedicated for patient treatment, and there are various programs that we have, again, substance abuse, mental health disorders, as well as the post-traumatic stress disorder. So we have plenty of those programs and the inpatient treatment that not only serves veterans that are in our catchment area, but we also serve veterans that are in our network. And so there may not be that access, for example, in Atlanta or even in South Carolina, but we do accept those veterans for programs 45 days, 90 days, depending on what the protocol and need is for that veteran.
And inside of that new mental health building, what kind of amenities or what is it going to look like that's going to help out the veterans? It's going to make the process better for them.
So again, that building is primarily for outpatient care. So veterans that may have graduated from our programs or need regular mental health counseling will have an opportunity to meet with our psychiatrist and psychologist, as well as our social workers, to help them deal with their issues ongoing and have those regular one-on-one appointments. But there's also rooms that we've developed for group therapy, as well as our peer-led and peer support-led group therapy. So the building really is going to offer many different avenues for our veterans to get their mental health care.
This will be the second to last question. What do you say to veterans and their family members who have lost trust in the Dublin VA and the other branches around the area? What do you say to them to get them through that next day so that they can begin that process of trusting their loved ones, trusting the VA to take care of them?
So I think restoring trust obviously is critical. I think our staff, I think, is truly dedicated to caring for our veterans. And for those that feel like they have lost trust, I would ask them to give us another chance. And to again, as we've made these investments and hired new providers, to give us that chance. But then with the Mission Act, if they remain unsatisfied and we're not able to meet their needs, is that we can, in the best medical interest and based on what a veteran needs, we can bypass those rules and actually help them get that care in the community as well. So if they've lost trust in us, we can at least help them and navigate the healthcare system and get them the care outside in the community and pay those bills. Our interest is to make sure that the veteran gets that care that they've earned through their service to this country.
My last question, is there anything else that you'd like to add that that we may not have gone over?
Well, I do want to talk about the whole health program because I think it's really an outstanding opportunity to kind of change the paradigm in how we deliver health care. So right now our healthcare system is really focused on we identify a problem and then there's a clinical intervention to solve that problem. We want to change the dialogue and literally have a veteran come to us and say, this is what matters to me in my life, and I want to develop a health program, a preventative health program that will help me be successful in my life and help me be healthy. I know the VA will always be there for me when I'm sick, but I want to be healthy. And so literally we are establishing a whole health program here in concert with mental health programs as well, so that when we can actually teach veterans about good exercise, good nutrition, good sleep habits, everything that we know that science tells us what leads to a much healthier and happier life, and including a purpose-driven life. And truly, this is a mind, body, and soul whole health and holistic program that we will train and teach our veterans how, again, to be more healthy. And so I think this will be a unique way for us to deliver that health care, and I'm excited. This is something that really isn't often offered in the public sector, or I should say in the private sector. So this will be a new program for us. We're going to be hiring 25 new people, new staff, not just a clinician and other providers, but also whole health coaches. Literally people who are trained to sit down and work with veterans and put together a health profile and a set of goals and objectives, and then help that veteran, coach that veteran to having a healthier lifestyle.
Mm-hmm. Are these going to look like classes, or are they going to be one-on-one sessions? What is it going to look like?
It'll be a combination. Some of our veterans learn better in a group setting, and what bound them through their military service was that group cohesion. So some of the training will be group classes, but some of our veterans may be more responsive to the one-on-one intervention and training and teaching and coaching. We'll also have a chance to partner with local YMCAs for gyms and for other health opportunities out in their communities, but we'll be investing internally in enhancing our gym here, so our veterans will be able to come in and use the gym that we're going to be expanding. So I'm excited about those opportunities, but again, it's truly thinking about what creates health, and we know there are so many different things in science that will lead to a better outcome. And I think it will also lead to better access. So, for example, the veteran who may be at a pre-diabetes stage. So we would sit down with that veteran and explain to them that if they continue on their current lifestyle, they're likely to develop diabetes, and it will create a whole host of other problems for them. But through diet and exercise, they could control this problem and have a much healthier outcome and not be reliant on insulin or other drugs. And then, again, it's a lower cost way to deliver that care, but a much healthier way. And really, then it empowers the veteran to say, I'm in control of my own health. I have purpose as it relates to my health. And then we help them and coach them towards their end life goals.
All right, perfect. And is there like an estimated start time for this program? Or?
So we literally start hiring the clinical director and the whole health coaches, as well as a few program administrators. So my hope is that within 6 months that we'll have the team, the space, and everything else, and we will have trained our staff to be able to start this program.
All right, perfect. That's about it.
Okay.
Thank you so much.
All right, thanks.
You.
Yeah.
Thank you.